every day it is about how do we help more people, or even help more people help themselves by seeking this understanding, seeking their personal health baseline, that they can then actually identify the earliest signs of illness and prevent those health problems developing into diseases. You know, the need for personalized care instead of sick care is really true to its literal meaning. We can be benefiting as young as possible. All of these protein biomarkers are going through our bloodstream and have so much information and change on a regular enough basis, and can change for the better and can change for the worse. So we can avail of what the product is, which is a small blood sample is drawn and you receive a list of biomarkers being measured on that blood sample, which is done in a Randox laboratory, and you get this full personalized report. We add more tests every year, so now we're at 180, and we have a top package which offers everything of a 250 plus. We try to keep it simplistic because it can sound overwhelming, and therefore we have an entry-level package and a top package. So we have two product offerings. The Every Man, Every Woman is our entry level. You get about 165 tests. You actually get the whole set of testing done twice in 1 year. The next day, sometimes the day after, you'll get your report of your results. So you'll see those 165 pieces of data. You'll have a understanding of what do those mean. It'll tell you what the test is, what does it mean, where are you on a red, amber, green scale, and it will pull forward any results that are, as we say, in the red. So you'll see those 165 pieces of data. You'll have a understanding of what do those mean. It'll tell you what the test is, what does it mean, where are you on a red, amber, green scale, what's normal, what's the reference range, where do you lie, and it will pull forward any results that are, as we say, in the red. And then our top package is our VIP package, or our access to everything package. And that's just for somebody that does want access to everything, to genetic testing, to home test kits, whether it's for bowel health testing or genetic heart health, sexual health testing, and respiratory health. And you can have those throughout the year. So you follow your plan, you come back in for your repeat testing, and it starts to get mapped and charted and tracked, so that you can see if your actions are improving and optimizing your data, and get the expert consultation privately as you go through. So basically, it is so normal for people to get a chronic condition and live with it, and a chronic condition quickly turns into what we call comorbidities, which are multiple chronic conditions, because everything in the body is interlinked. That should not be our norm. 15 million people in England alone have chronic conditions. And I think they say something like 40% of over 65s have one, and at least 15% have more than one. Point being, preventing any disease developing in your body is as simple as establishing your health baseline. I always like to say, I really should coin this or patent this in some way, is direct access to answers, DATA. And that's really what Randox seek to do, is give you the direct access to answers now at a time when you can actually apply it and do so much about it. So in the later packages with Randox, where we'd added more tests, it turned out that my celiac antibodies were sky high. So this is an autoimmune test for celiac. Gluten impacts your immune system by telling it to essentially attack its healthy cells. This started obviously to shed such a light on all of my issues. And what was happening was the white blood cells were so severely depleted because I had had this for years and years and years, and my immune system was just broken. Any sort of healthy supplement or vitamin that I could get, I was, paying for and taking and not seeing any change in my results. Also, I had had no periods for about 10 years, and I had seen doctors multiple times. Again, I felt well and I wasn't overly concerned. I had been on and off birth control pills, which is quite the norm. And you hear that it's quite the norm, that for the odd person, it takes a long time for them to come back. But, at the end of the day, I know that that's hearsay and old wives' tales, and really there is usually a scientific reason for most things, especially when it comes to the body, because it's a huge work of art, but it's a larger work of science. And I just cannot imagine what my life would be like now that, that I was 25 at the time, and to have the autoimmune disease nipped in the bud and under control at 25 makes huge changes to my body. And to bring all of those potential problems to my personal attention so that I can read or learn or action or prevent is so powerful that it is truly life-changing. Randox have so much scope for successes in such niche and acute care, and also across the board into so many diverse industries, that Randox probably are set to benefit so many industries in such a huge way in future so it's really disruptive, it's really fascinating, and it's really here to help a lot of people in a lot of industries.